I'm Judith Anderson, an Associate Professor of Physical Therapy. As a physical therapist, I have treated many patients with arthritis. This presentation covers some of the concepts about arthritis and about the care of patients with arthritis. Arthritis means inflammation of the joints. There are many kinds of arthritis, but the two most common kinds are osteoarthritis and rheumatoid arthritis. Osteoarthritis, the most common form, is degeneration or deterioration of the joint cartilage. It is usually localized in a few specific joints, and it is caused by trauma to the joint and is associated with aging. Rheumatoid arthritis is very common also. It is a systemic disease affecting many joints at the same time. It is inflammation of the joint lining. Anyone can get arthritis. It can occur at any age. It can strike athletes or sedentary people. It can be severe or mild in its symptoms. It may flare up and then calm down, or it may follow a steady course. Certain conditions affect arthritis. Overuse of joints and muscles makes it worse, while rest makes it better. Exercise relieves pain and pressure on arthritic joints. A patient may have symptoms at different times during the day. Patients with osteoarthritis feel better in the morning and worse at night, while patients with rheumatoid arthritis tend to feel worse in the morning. Humidity and cold weather may cause pain and swelling in joints. Although arthritis cannot be cured, it can be managed. Management varies with the kind of arthritis and with each individual's symptoms. But there is an overall pattern of treatment and management of the symptoms. The general goals of arthritis treatment are 1. Reducing pain and inflammation of joints. 2. Increasing joint function and muscle strength. And 3. Preventing bone and cartilage destruction. The patient must take responsibility for managing his condition. There are 5 components to management of arthritis. First is regular communication with a doctor. Second, learning about arthritis. Third, rest. Fourth, diet. And 5th, regular exercise. The first requirement for the management of arthritis is that there must be regular physician-patient communication. The patient needs to find a physician who is knowledgeable about arthritis and to follow the advice carefully and completely. He must take medication on a regular schedule to keep the blood level steady, and he must set goals with the doctor. The patient needs to be aggressive about his health and see the doctor as soon as the condition changes. If there is pain, anti-inflammatory agents which control swelling and fever, or analgesic agents which control pain, are prescribed. Physical and occupational therapy is used to increase function and activity, and surgical intervention is sometimes used for joint release and joint replacement. Second, in the management of the disease, the patient should learn all he can about his condition. Managing arthritis requires understanding the disease itself and the symptom changes that occur over time. As the condition flares up, the patient must reduce his level of activity and protect his joints from stress. As the condition improves, the patient must increase the use of joints and increase the activity level too. There are many resources available for the arthritis patient. The Arthritis Foundation provides a wide variety of educational resources. Third, rest is essential for healing and decreasing inflammation. There are 3 ways that the arthritic patient can rest his body. First, pacing. This means that the patient should alternate periods of activity with periods of rest throughout the day. Second, total body rest. This includes good sleep at night and naps during the day. And third, resting inflamed joints. Inflamed joints need to be protected against overstretch and overuse. This is given by splints or by special positioning of the painful joints during sleep and rest. The patient needs to control his diet too. Good nutrition is necessary for repair of diseased tissue and for general good health. Please refer to your nutrition lecture for the specific rules about good nutrition. Weight control is also important because any unnecessary weight adds to the stress and pain of joints. The fifth factor, regular activity, is an important component of arthritis management. The patient needs to exercise every day. The exercise appropriate for people with arthritis is the same as exercise for everyone. But it must be modified to fit specific situations so that the patient will not be fatigued or overuse the muscles and joints. Exercise should include walking every day to increase exercise tolerance and keeping in good general condition by doing stretching and strengthening exercises. It is important to prevent complications of arthritis by maintaining and increasing joint range of motion. Motion must be maintained or it will be lost. Please refer to your range of motion lecture to see about this kind of exercise. It is essential for the patient to know how much is enough exercise and how much is too much. The symptoms of overexertion are pain in the joint and muscle, fatigue, and change of personality. The only symptom of a person becoming over-fatigued may be a change to irritable and cranky behavior. Overexertion is common when a patient has bursts of activity, such as weekend athletics, when the rest of the week the patient is quiet, or when doing heavy chores for a long time without rest. Involvement in social activities, such as community activities, church, and visits with friends, is another form of regular activity. Your role as a healthcare worker in the care of patients with arthritis includes following care plan, assist with activities of daily living as needed, utilize adaptive equipment, help to avoid fatigue, pace activities, and protect joints. You can help protect joints by assisting use of stronger muscles, help distribute weight over many joints, encourage to change positions frequently, limit repetitious movements, help modify chores to avoid stress on joints. Mobility, or free joint motion, is very important. Joints and muscles must be used frequently, or they will tighten up and cause contractures. Range of motion exercises will help patients to keep their motion free. These exercises consist of moving each joint through its full range of motion several times daily. The exercises can be done lying down, sitting, or standing. It is important that the patient be in a stable position with any needed support to keep the patient from falling. If the extremity is weak, the caregiver must support the part that cannot be supported by the patient. These demonstrations follow.
This first demonstration will show the caregiver assisting a patient to do flexion of the shoulder. Notice the hand placement. Many times the joints are painful to pressure, so hold on to the fleshy part of the arm. Speed is also important. The motion should be slow and controlled. That means that the patient's muscles should be strong enough to keep the part from wobbling. If they aren't strong enough, the caregiver should help support the arm, but have the patient do as much of the motion as she's able. Help the patient to go to the greatest joint motion that does not cause pain. Do not force any joint to go past the point of easy, pain-free motion. There are other shoulder motions as well. The first is called abduction, moving from the center outward. Another is called rotation. Other upper extremity motions that should be done are elbow flexion and extension, wrist flexion and extension, followed by finger flexion and extension. Lower extremity motion should also be done on a regular basis. The first is hip and knee flexion and extension. Then hip abduction. Finally, ankle, dorsiflexion, and plantar flexion. Dorsiflexion, plantar flexion.
The motions that you have just seen can be done lying down, sitting, or standing. There should be 5 to 10 repetitions of each motion, 2 or 3 times a day. Both sides of the body should be exercised, even if only one side is affected. You should monitor the exercise closely. Stop if the exercises cause pain. Try again later, the same day or the next day. Report the pain response to a nurse or a doctor or a physical therapist. The position that the patient assumes in bed or in a chair can cause serious pain and contractures. Any position, if the patient is in it for too long, will cause tightening of the joints or formation of bed sores. Therefore, it is important to encourage the patient to change positions regularly. Now, watch some demonstrations of positioning.
A pillow under the knees will relieve pain and tightness in the knees and hips, but if there's always a pillow under the knees, the patient will develop contractures of the knee and hip flexor muscles, and the patient will not be able to stand straight or walk safely. So it's important not to place pillows under the patient's knees as a regular practice. The same principle holds for pillows under a patient's head. Many patients learn to sleep with 2 or more pillows. This causes extreme forward flexion of the neck and distorted posture. Use as small and flat a pillow as possible under the head. When a patient is weak and unsteady, you must assist them out of the chair or bed. Hold on to the patient rather than letting the patient hold on to you. Have the patient lean forward and move the hips forward in the chair. Be sure that the feet are firmly set on the floor before standing. The patient should assist by pushing up from the chair with her hands. Then wait a moment to gain balance before starting to walk. Then proceed.